My name is Edward McGillicuddy. I actually go by Ted. I'm a vascular surgeon. I've been a vascular surgeon for about 10 years. I joined this group at Maine General Medical Center in February of 2025. I find vascular surgery totally fascinating. It really involves complex anatomy, the way the blood vessels are shaped and the way they work together to do their job, moving blood around the body. And there's really interesting variations from patient to patient. One of the things that I like the most about vascular surgery is the creativity you can use that really tailors the treatment to that patient, to what they need, their anatomy, their history, parts of their life that you have to kind of bring into the fold and bring into the treatment plan. And I think having this kind of breadth of experience where we both do things that involve traditional open surgery, which is made using an incision, and some of the endovascular or minimally invasive techniques that we use. So the technology in vascular surgery is absolutely incredible. It gives us a really good opportunity to look at that patient through all different lenses and try to figure out what's the best way to treat their problem, their particular vascular issue. I think we have a fantastic team. We have 4 vascular surgeons that are they're board certified in vascular surgery. They're subspecialized in vascular surgery. And although we all have some common aspects of our practices, we have different specialties inside of our practice that allows us to really function as a really comprehensive group, treating patients that have arterial problems, vein problems, problems with dialysis, aneurysms, and we really encompass that all the broad aspects of vascular surgery, and I think we really work really well as a team. We also have a very cutting-edge vascular laboratory that allows us to get really nice, beautiful, non-invasive imaging that allows us to take care of our patients. And we do it in a really nice facility. That's a new facility that's got that updated technology that we need. I think our goal as a group is to give you the technology and the expertise that you would get at a big hospital and a big program, but with a smaller family type feel where you're not treated as just a number or just the next patient coming through the door. I think what Maine General offers patients with regards to vascular surgery is comprehensive care in an environment where you're treated like an individual, where we pride ourselves on access, the ability when a patient or a provider reaches out to you to say, it's not going to be months and months and months before we can get you in. How do we get you in the next couple of days? How do we get your records in? How do we get to know you and your family and really provide a comprehensive vascular surgery treatment plan where you feel like you've gone to the big city hospital that has 1,000 beds or however big it is, but really get that care in your community that's still cutting edge, still current, and have a feeling that you got really what you needed, but you got to stay relatively close to home for it. Well, I have 3 young boys, and they are at that age where they're into everything, sports, theater, music, art, and so that's a really passion of mine, provided to be the dad that's a chauffeur on the weekend and the nights, getting the children to where they need to go. The other thing I think people should know about me is, I think for me, my work passion, that vascular surgery passion, is really powerful in me. I really think about vascular surgery a lot. I think about the patients, I think about the anatomy. It's a profession I think is a calling, and it allows me to do what I love, and to be able to do what you love with a great group of people and also benefit patients as a #1 goal that we have. It's a really great discipline to be into.